Todd.
I can hear. I can call him. No.
Oh, he's on there.
He's not.
Something's wrong with my audio.
The March 20th Government Operations Committee. Welcome everybody that's here.
April 17th. April 17th, yeah.
April 17th.
Let's not go back in time.
Monday, April 17th. 1 o'clock meeting. Can I have a motion to approve the March 20th meeting minutes?
Second.
All right. All in favor say aye.
Aye.
Okay, moving on to, so we got a healthy topic to discuss with ADA inclusivity and facilities, and I hand it over to Josh.
Yes, thank you all. This is our first meeting really tackling this subject. And so we have about 4 very kind of high level agenda items for today. So we're only talking about evaluating the opportunities for inclusive Athens-Clarke County facilities, which was assigned in May 2021. So about 2 years ago. So we're really excited about tackling this. But we have 4 different staff members who are going to share today. We're going to start with Attorney Jackson. Austin here is going to share a high-level overview of ADA and some of the legislation and the implications that has. And Cynthia, if you could bring up the document, not that one, but there's a document titled Transition Plan in there that I shared with you. So there was a number of high-level documents. We wanted to talk about them before we shared them with you, but after this meeting, I'll create a folder and share that with you all so you can have all this at your fingertips. But some of them beg a lot of questions that we wanted to talk through first. So Cynthia's going to first share this transition plan, and Austin's going to walk us through it and hit some of the high notes of ADA.
Absolutely. And Cynthia, if you could turn it to page 4.
It's got double.
Yeah, if you go down to that single pane, bottom right, Cynthia. Oh, it's a different document.
That's not the same.
If you go back to where you are, it's that Word doc. And then the bottom right, there's a single pane. You can click right there. Yeah.
There we go. Okay, page 4 is really the relevant page for today's meeting. Okay, thank you, Cynthia and Josh. So let's talk ADA. So that stands for the American Disabilities Act. This is a federal law, so it's federal legislation that is applicable to all 50 states. This was originally enacted in 1990. And broadly speaking, the ADA provides rights for persons with disabilities in the area of employment, in the area of state and local government services, and in the area of access to public accommodations, which are things like restaurants, everything that's open to the public at large, transportation and telecommunications. And so the ADA itself is very expansive. And so for today's purposes, I really wanted to highlight the Title II of the ADA with respect to public services. you can scroll down a little bit. There's like and so this document, the ADA transition plan is very, very expansive. I encourage each of you to kind of take some time to really look at this after today's meeting, because there's a lot of good information the staff has already compiled into this document. But by way of overview, as it pertains to Title II regarding public services, the fundamental, mandate is that no qualified individual with a disability shall, by reason of that disability, be excluded from participation in or be denied the benefits of the services, programs, or activities of a public entity. So in a nutshell, that provision of the ADA essentially says that the persons with disabilities should not be discriminated against just because of their disability, and the government cannot otherwise exclude them from participating in government programs or being able to access government facilities, things like that. And as I mentioned earlier, the legislation was adopted in 1990, 1991, somewhere around there. But in 2010, the Department of Justice published some revised regulations to Title II regarding public services and Title III that pertain to public accommodations. And so I think that it's important to kind of focus on those and understand that although those new regulations were put out in 2010, there's a safe harbor provision of the ADA, and that basically says that if the government building was in compliance with the previous regulations in 1990, 1991, then we're not required to update our existing facilities to comply with the 2010 guidelines. Now, there's a caveat to that. So if there was going to be new government buildings constructed after 2010, then they would have to comply with the new guidelines. I'm sorry.
Okay. So slowly, so 2000 and so 1990, they provided provisions, and then there was a new provision in 2010. But can you go back over the 2010? I was writing.
Sure. And so just thinking, to illustrate it, like broadly, the statute was passed in 1990 or 1991. I keep going back and forth, but early 90s. And then about 2 decades after that, the Department of Justice sort of provided an update to that and said that if there are existing facilities that were in compliance with the 1990 regulations are not necessarily required to revamp all the current government buildings to fit with the new standards. And there are some exceptions to the 2010 standards, and so like there were certain things that were not included in that safe harbor provision, such as amusement parks, golf facilities, and things like that. All these things are enumerated in the statute. But I guess what that means for ACC Gov is, we have a lot of buildings that are older, and were built at a time when the 1990 regulations were in effect. And so certainly as we're thinking about, making our facilities more inclusive and for the GOC determining what, is the level of service that we want to provide, just be cognizant of the fact that several of our buildings are sort of grandfathered in and under the 1990 regulations.
Was the 2010 updated provision, were they significant?
That is a good question, and I don't have the actual update in front of me. I'm happy to.
Yeah, Chief Daniel.
Perhaps Chief.
Yes, I would say so. The 2010 updates were very significant. It included a broader scale and came in with a lot of details. The ADA, the 2010 ADA, you can pull that document up. I think it's ada.org. And you can pull that whole document up. It gave you the detail on each individual asset of ADA, accessibility, parking, number of parking spaces, height of communications, door width. It got very detailed.
So if we remodeled a building, if we had a building in 1990 that was in compliance, and we remodeled in 2011, it had to follow through the 2011 guidelines. If we just remodeled, made some modification.
I would say yes.
Okay.
So That kind of concludes my high-level overview. I'm happy to take any questions if you have specific ones about the regulations or anything.
So one of the things that's in the document that we'll share after this meeting, so this is a transition plan that the unified government created in 2019. And so this was in response to ADA and looking at all of our facilities. So this might be a document that the GOC recommends we update since it was last done in 2019. But we wanted to talk a little bit about it. So in this document is the material that Austin was sharing, but also, Cynthia, if you can go to page 11, it's where the document begins to talk about our buildings and facilities, which is the focus of this item for the GOC. And so one of the first things it talks about is historic preservation. So not only do we have old buildings, we have some historic buildings. We've got Taylor Grady, we've got City Hall, we've got where elections is right now, which is called the Civic Hall, I think. So we've got some very old buildings that are handled a little bit differently because they're historic buildings. And we'll talk a little bit more about that as we go through these items. And Beth has a spreadsheet that shows some of those on there. But that is one thing to consider. And in this document, it lists, if you keep scrolling down, Cynthia, it lists all of our buildings that are historic. So you got Church, Brumby, City Hall, you got the courthouse, Fire Hall number 2, Morton, Taylor Grady, and the Linden House, Ware Linden House. And then there's also historical properties around the county as well. So this is a comprehensive document. So it's more inclusive than the topic y'all are focused on, but we wanted to start very wide and kind of work our way down. But we will share this and we will continue to kind of reference what Austin and I talked about in the following conversations today. But is there anything else just in general about ADA federal legislation that y'all wanted to ask? No, and we could talk more about it, but it's ada.gov, and this document might be one of the things we recommend to be updated as GOC, but this is what our plan is in relation to ADA, what we're going to do, and it lists specific facilities that we've upgraded since the last ADA law change, and we could update that list as well since 2019. So we've done a lot of work since 2019, and we might want to inform this document. So
And also having that document build that's not ADA equipped right now, and that particular document.
So this document basically looked at everything that we had and came up with kind of what we've done and if we were in okay shape, and I think we're doing just fine. We'll talk a little bit more about that. But what this did was talk about the new buildings and the new construction that have been added and making sure that's ADA, and then it's also talking about different upgrades. If you go to the back of the document, Cynthia, there's something called a transition plan matrix. And so ADA does require a transition plan like this. So this is a requirement. And so you can see where we've invested funds and what our plans were going into some of these out years with our SPLOST projects. So a lot of these projects are SPLOST related or T-SPLOST, and there were commitments we were making to improve our facilities.
Motion that we update, include to update that as well.
Okay, definitely.
Second that, yes, sure.
All in favor, say aye.
Aye.
All right. So from there, we wanted to introduce Dr. Remy Epps, our inclusion officer. She and her team have been doing great work on a language document. So Cynthia, if you don't mind bringing up the PDF. So we all know how important language is and having shared language. In relation to this topic, Dr. Epps has been working with her team to pull together a comprehensive list. There is a document that we'll share that's 11 pages long.
The 88 times definition.
So there's a document that's 11 pages long of different definitions, and we're not going to go through that today, but we'll share that in the folder. Dr. Epps has got us down to a 2-page document, and she's going to talk through that today because we want to make sure we're all in agreement about what the words mean and how important the language is in relation to ADA.
Yeah, so hi everyone again. I'm Remy Epps, the inclusion officer here. As Josh has said, this is basically just to summarize when we're starting to talk about inclusive facilities and updating things. I think it's very important that we, in conversation, making sure that we're using the correct terminology because this can be difficult to understand when we start talking about different codes and different groups of people that changes might be affecting. So making sure that we're all on the same page when we're talking about accessibility. So the important thing is the goal is not to exclude anybody, but ensure that everyone has access to the same civic activities, walking, reading, doing anything that any person who that doesn't have an impairment or disability is able to do. So it's just making sure that we have things in place that everybody can participate. It's not about special privileges or trying to exclude anyone from anything, but it's making sure that everybody is included and able to do the same activities and be able to be in the same spaces, regardless of their abilities. So in this document, it is basically a summarized language similar to our shared language project that we have within the inclusion office, basically about ADA. So if you scroll down, Cynthia, just general rules when we're talking about persons with disabilities, that we keep that person first language there. So using person before we're talking about anybody's disabilities, just as proper procedure when we're talking about them. And refraining from the use of handicap, just staying away from those terms. So just making sure that we keep the humanization aspect of conversations.
So what would be the appropriate phrase or word? Is it persons with disabilities?
Yes.
Or,
yes.
Okay.
Yes, persons with disabilities instead of a disabled person. So keeping that person first. So
is physically challenged appropriate?
No, we would try to stay away from that. And in the larger document that we have that is getting fine-tuned, we're providing all of that language of how to properly go forward with conversations. But yeah, so we want to make sure that we're using, if someone does have a mental illness, we're using she or he or they have a mental health condition and not they're mentally ill. So it's just trying to keep that proper politeness, that courtesy there when we're talking about it. And then on the flip side, if we're talking about individuals who do who don't have a disability, referring from a normal person is kind of just makes that connotation that there's a normal, and if you have a disability, you're not normal. So keeping that that conversation in that context of people without disabilities when we're referencing those individuals who do not have a disability, and then obviously we always have individuals who do not feel comfortable disclosing a disability. So when we're talking about creating accessibility parameters within certain places, just be mindful that we might not always be thinking about the obvious disabilities, but there are disabilities that can't be seen from the eye. Parking, accessible parking versus handicap parking, just stick with accessibility, accessible parking. And then what is a reasonable modification? I think this is a lot of conversations where people get confused about what a reasonable modification is. There's an accommodation, which is more so of a service, if you want to say. But a modification is something within policy, practices, or procedures that we're changing to basically fit within the spectrum of allowing equal opportunity or access for individuals who may have a disability. But the caveat to that is as long as it does not create an undue hardship, which is anything that might be a substantial financial obligation that really takes away from the fundamental purpose of the program, service, whatever may have you that we're talking about. And then if we scroll down a little bit more. So if we're talking about public programs and services, I know that's not the focus of this, but thinking about when we're talking about changing or modifying buildings or accessible things, just think about it in its entirety. So all facilities might not be able to be upgraded. So thinking about how are we providing that accommodation or modification to services, thinking about it in its entirety. So if we're using this example of multiple swimming pools because of the limited resources, thinking about which ones you would want to do, what that would look like. We might not be able to do all pools or all buildings, but which ones would we be focusing on? Public entities, again, they must have an ongoing obligation to make programs and services accessible. City governments are not required to implement any actions that would present an undue financial and administrative burden. However, the obligation is to reduce that. So, and reduce the burdens that may be there. We don't have to do all of them, but we do have to have some type of process in place that are trying to limit down the burdens that may be in place. And then going back to the beginning conversation, historic buildings are not required to meet all of the 2010 ADA requirements if the modifications will threaten or destroy the significance of them. So, again, when we're thinking about upgrading buildings and facilities, when we're talking about the older buildings, there are things that we could do, but again, if it's going to affect the historical significance, we're not required to do it, but there are other avenues that we can go. But thinking back to the totality of upgrades, there still needs to be an equitable process or procedure in place to do that.
So, scratching my head on the city governments are not required to implement any action that will present undue financial and administrative burden.
Correct.
But prior to the 1990, 91, 2010, maybe if I had that document, I can repeat. But it pretty much was saying that we have to provide services. So for those who may be disabled.
So and maybe this is something Attorney Jackson would want to talk about, but it is fleshed out in this transition document. So because you're talking about the programmatic aspects of ADA, where we're talking more about the facility piece in GOC. But I don't know if there's anything you'd want to talk about in terms of programmatic. I think what Dr. Epps was referencing was some of the more finer details in kind of the responsibilities under ADA when it comes to programs and reasonable modifications.
Yeah, and I think that's a helpful way to frame it. They're, focusing on facilities versus programs. There may be different, honestly, different regulations, but different what it is you would ensure compliance with the ADA.
Any question? And please correct me. Those who may be autistic or Asperger's, they're PC.
So when you're just talking about individuals, it really boils down to how they want to be referenced. But when we're talking about individuals who may have learning disabilities, you would just say persons with a learning disability. But individuals who may be on the spectrum, there is, appropriate terms that we as society may have that have been started to be faded out from the community that just hasn't been brought to the forefront yet. And that's what my office is working towards, to provide that guidance on that terminology to use. But when we're talking about individuals that may have a mental illness or individuals who may have a learning disability, just making sure that the most appropriate way is always to put the person first before we talk about any type of impairment, physical or mental, that may be present. That would just be the rule of thumb. Just keep that person first.
Okay.
Yeah.
Thank you, Mr. Davenport. I wouldn't be a bad idea for us to have a work session with the rest of the commissioners on these terms and these terminology. Bring everybody up to speed and maybe a recommendation coming out of this once we get everything hashed out. Wouldn't be a bad idea for us to do a work session.
Mr. Davenport, to follow up on your question, I think some of the information that you'll find responsive to your questions on page 7 of the document.
Yeah. So you'll pull up.
Yeah.
So, yeah,
So we're certainly happy, so we do have to provide services and programs and activities for persons with disabilities, but, the legislation also provides that,
Bottom of page, there's
essentially that can be done within reason, and if overhauling an entire program would create an undue, financial burden for the entity, then we're not necessarily required to do that, but there may certainly be other ways we can, allow the persons with disabilities to participate in the programs.
okay.
Yeah, so this document maps out the steps, as Austin was sharing. So, providing services and programs, activities, ACC Gov does not deny a qualified individual with a disability the opportunity to participate in or benefit from a benefit, service, or activity. And there's 3 steps here, but it does clarify in that paragraph right after about the financial burden piece that Austin and Dr. Epps shared.
So, and I could be jumping ahead of myself, but when I understood evaluate opportunity to what the GERS had recommended, he was talking facilities and programs.
That's not my understanding, so you might want to follow up with the mayor. Because this came from the Nature Center as context, our understanding was this was focused on facilities and programs.
just facilities.
Okay.
And so what we've done based on our meeting last time with y'all talked about facilities, like buildings and parks. So we've combined the two, and then you also added bathrooms to that discussion.
That's right.
So we're ready to start that conversation today too. But
Keep it simple.
yeah, I think if we handle that one first, then potentially there's another topic and programs at a later point.
All right.
Perfect. All right, any other questions for Dr. Epps or Attorney Jackson before we keep moving? All right, so as you can tell, this is big stuff, and we're trying to kind of slowly get to where it's applicable to kind of present day buildings and parks. So next up, our Leisure Services Director, Kent Kilpatrick, is going to present a spreadsheet that he and staff have developed. And again, these are going to be shared in a folder for y'all, and these are very kind of wide lens. So what we've tried to do is list every park and facility, and I'm going to let Kent kind of give you an intro. We have a similar spreadsheet that Beth has for all of our facilities, and so we've got a lot of both. But here's a way for us to begin to kind of assess what we have. Kent,
Thank you, Josh. Appreciate that. Yeah, we've separated ours from Central Services has enough buildings to take care of, and we have a lot of our own, so we've kind of divided and conquered some over the years. But in Leisure Services, you referenced programming, inclusive programming. We've been fortunate in Leisure Services to have a recreation programmer who has a specialty in inclusive programming, who has that certification. However, they are not an ADA specialist, so it's important to separate the two, right? ADA access and studying of that is completely different from being an inclusive programmer or a therapeutic recreation programmer, is what their actual certification is. But we asked that position back before the pandemic, so we've been working on this for a few years, to go and start assessing all of our facilities in terms of their ability to be accessed, but not just the facilities, because we also need to look at our grounds in our parks. And ADA primarily focuses on buildings and access to those buildings, but there's a whole different set of issues when you start getting on grounds, accessing trails, accessing amenities within parks. So that's a different discussion, and we wanted to merge those two to the best of our ability. Now, as Josh said, you'll be sent this, and the color coding and the numbering system is intuitive to us. However, it's not as intuitive to the other readers, so we're going to clean it up a little bit to where it'll be a more simple, like a red light system of what's good shape, ready to go, what needs caution, and perhaps what needs definite word. But our park planning staff is represented here today, Todd and Emily, and I'm going to let them speak to what you're actually looking at. Understanding it is a work in progress, we picked this back up once we saw that GFC was getting ready to tackle this topic. We've been picking it up and starting to clean up on some of these access. But Emily, you want to give them a brief overview of what they're looking at?
Yeah, so the programmer who was training inclusivity, what he did, when he first started out, he had an Excel sheet which he kind of just did almost like a narrative view of You went to each facility that had, buildings or programs where the public would come to do like an event or something, and, it kind of just listed the things that were good and things that would have made it inaccessible. So we had that document. Then, I think he worked with, Athens-Clarke, with the, they got a program called Inclusion U, which is, it's online training so that you can do recreation inclusion assessments. And I think what they did is they have worked with GIO to get like a survey that went through that assessment tool. And so we have a lot of survey data where they went out and they actually did the nitty gritty stuff where like they measured door widths and ramp slopes and stuff like that. But again, they didn't do every single facility. So this spreadsheet has every single facility, and me and Todd went through and tried to fill in a lot of the blanks. There were quite a few blanks from those two different data sources. And what I did was I tried to take the language from Brandon, that's the inclusive programmer, saying that he put together. He kind of did wording that he used, and I made different categories. So we've got transportation, how do you get to the facility, parking, getting from parking to the facility, then mobility within the facility, and then we also added some restroom data. And so for each of those categories, I kind of outlined based on the language that the other two data sources used, what they kind of constituted as acceptable, and then what wasn't so great, and then what wasn't acceptable. And so that's kind of what the color coding, I would focus more on the color coding than the numbers is, what works, and then when you get into the yellow, what isn't great, but it's still okay, and then the red is, it's not accessible at all. So, and then I just went.
So Emily, one clarification. So if we could pick one example that's red, maybe, Cynthia, if you could scroll back over. Could you talk about maybe one example that's red and then speak to if it meets ADA or not, if it's red? So it's different too, because different categories. So like for alternative transportation, I don't think that's an ADA requirement. I don't think you have to have some kind of separate transportation to your facility. But that is something that Brandon looked at, and so I included it. And so like for Ben Burton, there's no bus access. You couldn't get off a bus and go to Ben Burton if you were in a wheelchair. Right. But some of our facilities you could. And so I included that. So the red there is you could not access it if you needed to use public transportation and you were wheelchair bound. But then like parking, some of it it's for Boulevard Woods, there is no parking at Boulevard Woods. And so we were actually talking. Period, there's no parking. Yeah, there's just no parking there at all. So you couldn't, unless you had someone come and drop you off and take you over there, you couldn't get there if you were in a wheelchair. But then once you're there, I think mostly at Boulevard Woods it's paved paths. Mm-hmm. So and then for restrooms, I guess putting them in red might be a little bit misleading, but it's what I did there was that's more of gender neutral in mind, because the data that I had for that is how many individual restrooms do we have at each facility, and then I had them categorized as to whether they were male, female, or family. Mm-hmm. And so those columns more so speak to the gender neutral aspect. I didn't, in that data, it doesn't tell me whether or not those stalls have an ADA accessible stall. Right. So we might need further investigation, because I think from one of those parts it says 7, yeah, and then it's only got one single unit restroom, but of the 7 restrooms there, they may all have an ADA accessible stall. So it just may not be gender inclusive, and that's what we need to work on, but it is ADA accessible.
So like you got number 7, does it break down for that 7, that men and women, or?
So that's overall. So that's and I can do that too. I can break it out into how many male restrooms are there, how many female restrooms, how many single unit ones.
Yeah, that would be helpful.
I could do that too.
Good idea. Yeah.
Can you scroll down to Aaron Hurd?
It's not, alphabetical, so I think that one's actually further up.
Oh, yeah, you
There it is,
just zoom
just
by.
past it, if you go down a little bit more. Yeah,
Okay.
seven. So some of these, so we're using the old names, so they ended up in different places.
So I can't see, but the red, it says number of something restroom that says 0.
Single unit.
Single, okay.
Yeah. So at her part, there are, I think there's 3 levels, correctly, and all of them have a, male, female restroom. And I think, if I'm correct, they all have ADA accessible. It's just there's no single unit restroom.
And then there's restrooms outside the pool house, but that's only open season.
Yeah.
Well, with that said, we still have to meet the accommodation though, right? All this season.
Right, so we footnote that out in the last column. There's season, for instance, at Memorial Park, that pool bathhouse stays open year round because there's not public restrooms on the top of the hill in the park. So we keep those open for the public to be able to access those throughout the year. So we footnote each of those in the last column, and you'll see that when you get a chance to.
Is there an ordinance when it comes to, person with disabilities parking, accessible parking? Is there, so like,
I don't know if there's an ordinance, but it is included in the ADA guideline.
so like, I'm saying like, if the facility is X amount of wide, you gotta have 2 parking spot, 3 parking spots, or,
Planning determines how many parking spaces you have to have.
okay.
Upon getting the number of parking spaces you have to have so many ADA accessible parking spaces.
So Boulevard Woods just has no parking, is the catch.
Princeton Pope Park is another one that's just like that. Once you get into the park, everything's accessible, but there's no parking on it or an accessible way to get to it.
Cause those are considered like neighborhood pocket park, so, they are accessible through sidewalks, or most people park on the side of the road, or, in the neighborhoods. But, from one of the, let me see, there was, we'll get this in a.
You will.
Okay.
And Emily and Todd, great job. I just wanted to clarify what the red meant, since it's not necessarily.
Yeah, it's not necessarily shut it down. It's just this is not, this would not be accessible.
And there's a tab at the bottom that says key down there, and that'll take you to the key that,
So like, it's not stuff,
yeah, that takes you to the key that Emily was working off of. But like I said, we're gonna try to simplify the process a little bit, so it's a lot easier as you reference each item.
One thing you have to also consider is in the future, as we start planning for stuff, is like, you're asking about the number of parking spaces. Usually you're talking about building access, but then we need to start looking at access to the zoos, to the pools, to the playgrounds and stuff like that, because currently, like at Memorial, the bathroom is above the zoo. And so the sidewalk that leads from the zoo up to the restroom is not ADA accessible. So for a handicapped person that's in the zoo to go to the restroom, they have to get in their car, drive all the way around to the front side to go to the restroom. And there's an ADA parking spot right at the gate of the zoo. But that's where in the future we need to work towards trying to get the amenity totally accessible.
The grounds are much more challenging than the buildings. There's a lot, and ADA doesn't necessarily always address the grounds. It says you're getting to a building. But there's national recreation park standards that go over and above that we're trying to measure ourselves against as far when it comes to grounds of parks and how we access those.
We are updating Memorial Park today, right? So can we make it more inclusive during that process?
Well, there's a separate zoo project coming in 2027, I believe. So there's another bundle of money coming for enhance the zoo. I would recommend that might be, we're already over budget with the current project that's in front of you from Memorial Park. that might be a time to address that accessibility issue is when we start tackling the zoo itself.
Yeah, so that's where we had kind of been, when we were doing the T-SPOS applications, we were looking at the zoo, including a new reptile house, which would have restrooms inside the zoo was what we were looking at when we developed that application.
And that's a really good question because, you know, when you think about this topic for GOC, it's not necessarily are we meeting our obligations under ADA as part of Athens-Clarke County Unified Government. It's what is the level of service that the mayor and commission want us providing is really the question, right? And so we do think that we are meeting ADA. And so Sandy Creek Nature Center and the Playscape, which a couple years ago is what kind of ended up this being assigned to GOC. You know, if we look at that and we think about it, is this meeting ADA requirements? That's one thing. Or do we think about that and say, is this the level of service we want to provide? And so the question before the GOC is really, what's that level of service? And in our facilities and our parks. And so Memorial Park, the zoo, Todd gave you an example. That's a really good example because the bathroom is ADA accessible, but is there something we can do to make it easier or we can work into future designs? What's that policy that you all want to inform future buildings? And I think that is something that would be beneficial, just like bathrooms, right? So if there's a certain type of bathroom that you want in every facility we build forever on into the future, then this is that opportunity to set that policy, and we'll go do it as we build buildings or upgrade facilities.
So I'm still stuck with, okay, so yes, when it comes to bathroom, make sure they're wheelchair accessible. I think it's like an extra 3 inches, 32 to 36. I could be wrong. I'm not a carpenter. Please, I don't want to hire me to do any carpentry. But like, make sure our bathrooms are wheelchair accessible, and Lord forgive me for saying that you have a lot of elderly people who have trouble getting to the toilets. So make sure that the toilets are wide enough that can get to, use them fairly easily. I'm not a big fan of steps, but, making sure that we have signs or navigate people to where they can use a ramp, get to the elevator. Because this building is very confusing. I had a cousin who tried to come, and I was ignorant, and I said, "Oh, just come to the front." And then I realized that he's not able to come to the front, so you have to literally walk around. Well, you have to go around, still go up some steps, or go from the sidewalk to get here. So it's those type of buildings that creates extra steps that I like to, extra steps that are burden for people with disabilities. But we can look at our facilities from that aspect and say, parking, lighting, bathrooms, sidewalks, ramps, where people can just, use our facilities freely.
That's a good point, Commissioner Down. And even to your point, we've recently been replacing a lot of old style water fountains with new bottle fillers, and we're installing them at levels where they can be accessible for everybody. So we're trying to, for the past several years, we've been trying to take that into consideration for everything we do in our park.
And one additional thing is like the National Park Service takes it to another level, and they start looking at universal design accessibility. And so that begins to dictate that your accessible parking spots are within 200 feet of a building, or they start looking at the door pulls and the number of push buttons, and so it's another level above.
You get a pretty deep dive into this stuff. It's very in depth.
It's
I'm going, see, like David booted me up. We do the same thing 8 years ago. We do the same thing, a combination of all the whole building and start doing some of the stuff with school districts.
Yep.
I get it, but how important it is for our community to be able to access our buildings, so it's important.
That's right.
For sure.
All right, so there's about 25 different parks on this spreadsheet, and y'all will have that, and you can look into it a little bit more. We'll continue to refine this list as we study this topic. We're going to share, next up, Beth is going to share our facilities list. I think there's upwards of 70 facilities, and you said this isn't even all of them.
Yes.
And so Beth's going to share that list with us. And after she's done, if y'all could think about what other kinds of information you might need. But with that, I'm going to hand it off to you, Beth.
Okay. Gavin and my name is Beth. I'm the facilities management. I'm the facilities administrator. So Gavin, our interim director at that time, instructed me to take a look at some of our buildings that were more public use buildings. So we take care of 259 structures in facilities management. And of those, we pulled out about 72 of them that we felt like were more of a public type building that the public might access. And so when we did that, we went in it and we looked at, he had me look at whether there was handicap parking available. Once someone parked, were they able to get from their vehicle to the building? Once they got to the building, could they get in the building? And then could they easily access the interior of that building? And if it was a multi-floor building or more than one department in that building, could they get to where they needed to go to see who they needed to see? Then we looked at the number of men's restrooms, ladies, unisex, private restrooms, and then other restrooms. And not many have other restrooms. Our facility has an other restroom. It's just dedicated to our some of our workers that we get through corrections. I didn't break them down as far as how many stalls were in each restroom. We counted like men's restrooms could be 1 stall or it could be 10 stalls. Then we also looked at which buildings that might currently have a baby changing station or could use a baby changing station. So, and where you would put it and things like that. So that's how we broke our list down. And we did have some that fully meet, and then we had some that do not meet on several levels.
And we'll get all this in the folder. For the bathrooms, can you walk me through the steps? If they are men's stalls, you want to convert them to unisex.
Mm-hmm.
How is that? You just take out the urinals? How that work out?
If it is a single men's restroom or a multi-use?
Single.
Single.
Yeah.
I mean, you could leave a urinal in there. I mean, you could have a unisex restroom that has a toilet and a urinal.
Yeah.
And easily just change your sign outside the door to say, just restroom or unisex.
Would that be offensive to?
No, but there has been best practices if we're getting on the technical terms of unisex or gender labeled. Some places have just changed it to restroom.
Restroom. Mm-hmm.
Yeah, just to a restroom and not labeled it some type of ascribing gender label and just cut the whole thing out and just say restroom.
And I don't know if y'all want to go there now, but Doug's here to share about code because that's really kind of the crux of your question is what number of bathrooms do you need in a building based on the number of folks that are in that building. Right. So I don't know if you want to go there now or wait till Beth's comes.
That's important.
Yeah.
So Doug, you want to just share real quick?
Yeah. Before we go though, but I do think we probably need to check number stalls.
Okay.
Yeah.
Okay.
I think, especially if we got to change stuff out.
Mm-hmm.
I think that's the important to know.
Okay.
Okay, so the important distinction to know from a plumbing code standpoint is that the plumbing code tells you how many fixtures of each type you need, not how many bathrooms you need. So if you walk over to the Classic Center, you'll walk into one of the restrooms and you may have 5 urinals and 10 stalls. Well, that can accommodate that many people. So I know over on Gardy Street in our building, you have what's labeled the men's and women's room. The men's has 2 toilets and 1 urinal, so it can accommodate 3 people. If you put a lock on that door and changed it just to restroom, it would only accommodate 1 person at a time. So you have, we want to be cognizant of that as you decide to designate restrooms because you're reducing the number of fixtures available. Now Doherty Street has a good setup. We have a men's and a women's public restroom with 2 fixtures each, and then we also have a single-use handicap accessible restroom that I think is labeled unisex, which is a code term that can be changed. So the plumbing code says, plumbing fixtures shall be provided in the minimum number as shown in table 403.2, based on the actual use of the building or space. Uses are determined by the building code or the life safety code from the fire marshal. So an assembly occupancy like the Classic Center is going to have hundreds and hundreds of people. And so you've got to provide, according to this table, you might have to have one toilet for every 25 people or something like that. And then what you do, our Doherty Street might have an occupant load for the whole building of 70 people. And so you've got to provide that many fixtures. Now, currently, the plumbing code, we're into the 2018 edition, and it is men and women and unisex or family. I'll tell you that I have heard and read that the codes are going to, they're progressive, but they're a little bit behind the times typically, because they go through a cycle where they vet all these changes through committees and then they vote on them. And then eventually the states will adopt those new versions. So eventually I think the codes are going to be more gender inclusive, but right now they're not. Not specifically, but I think the single-use restroom is the way that we can provide accessibility to all folks. We just have to be aware that when we make a restroom single use, that you might be eliminating some fixtures available.
And it could be hard in some buildings because the number of fixtures we need in a certain building. If you were to take I don't know what building might be a good example, but if you were to take one.
Courthouse.
Yeah, so you want to kind of just walk us through that example, but
Your courthouse has, on each floor, your courthouse has, a ladies' restroom and then a men's restroom. So you've got a total of 5 ladies, 5 men that are public restrooms. I think each restroom in the ladies has 4, and I'm not positive in the men, but I think there's 4 and maybe a urinal, or 3 and maybe a urinal. I'm not positive there. You have a couple of private restrooms at the courthouse. You have 17 private restrooms, but those private restrooms are going to fall in judges' suites and in jury rooms. So I don't necessarily think those would be considered public restrooms. Those are going to be more of a private thing. And then we do have, excuse me, I take that, that's going to be like in the jury, the judge's offices and offices, magistrate court, things like that. Your jury rooms, there are 4 unisex there. So, the courthouse would be really hard to do that because if you lock down a ladies' restroom for one person or a restroom on a floor for one person, then you're down to just 9 restrooms. So you really could run into an issue there.
And you bring up a good point about the codes, because the amount of people that use a facility like the Classic Center, thousands, hundreds, so it makes sense to have, stall style bathrooms and converting those into single. Like I said, we'll change it to single use. And that'd be a very expensive endeavor to move all the stalls. So brainstorming, even considering the courthouse, and you said there's multiple stalls for the men and the women on each floor.
Yes.
so one of the things to think about is what might be a recommendation for all future buildings we build. So we're hopefully going to build a new courthouse, right? So is there an opportunity to speak into, on every floor we want to have a single use, a men's and a women's? Is that something? I don't know. And we can look at what best practices are for other local governments around the country in terms of having a policy like that in future buildings. You could also think about current buildings. City Hall, for example, there are a lot of single-use bathrooms already. So is the recommendation just put a new sign on it, and this is what the sign should read, and that's the recommendation for current facilities. And then if there's something to look at in terms of our other buildings where there's the potential to add a single use, we could look at that. Which of our current buildings could we add a single use and still meet the number of fixtures that we need to in that requirement? So I can't think of an exact example where that would be possible, but maybe if we look at all our facilities and respond to y'all at the next meeting of, hey, here's a couple places that you could make this one single use and still meet the needs of the code.
Right.
Fortunately, you've seen a lot of family restrooms recently, or where it's a single-use restroom designed to go and take care of a baby typically, and those are obviously single-use restrooms. So I think you, in my mind, you would never build a classic center without those multi-use bathrooms, but you could always also have a single-use bathroom.
And do we have any particular building besides the courthouse that we get a lot of use of people in and out?
Public utilities, Doherty, Satula.
A lot of our major services buildings.
Right. So maybe those be there. We can look at that first.
Okay.
Most activities.
Sure, we can do that.
And then go from there.
It's a good idea.
Satula is a multi-use though, right? It's like a
There's several
single.
apartments in there.
Look at those buildings first.
All right.
And Beth, was there anything else you wanted to share in your spreadsheet?
No, sir, that's all.
All right, so you'll have that in your folder as well, and kind of go through there and let us know if you have any questions. But that covers about 70 different facilities, and so between the two, you have 100 potential facilities and parks to look at. And this is our first initial assessment. So I think one of the questions we have for y'all is, what do you want us to focus on for next meeting? Kind of hearing all that, what can we begin to do based on all that contextual information?
So for me, I like the idea of looking at the National Park Service's universal design to retrofit or to make our parks and our facilities more inclusive, like lower water fountains, bathroom sizes. Also looking at the potential of the family restrooms in all facilities, if that's feasible. What do y'all think?
I have a quick question with that.
Go ahead.
And so when you say family, are we in the conversation, is there a possibility that restrooms are going to be erect? Are we going to start building bathrooms, or are we just fixing the ones that we already have?
It'd be very costly to build.
I thought so.
In current buildings?
Yeah.
Yeah, I think,
So we,
you first.
uh-uh.
No, I think y'all were just asking questions earlier, and we were sharing that conceivably we could look and see if there's any facilities where we could go from multi-use bathroom to single use. That's not something we have at our fingertips based on the code, if we can't answer that question. But something like Costa and the courthouse, which are new facilities that will eventually be coming online, that would be easier for y'all to say, hey, we want to see this in future buildings.
Anything?
I think the number of stalls will help for that perspective. And again, looking at the most just buildings we're using right now first, and then we can sort of narrow that. Maybe that will help us along the way. Good idea.
Right?
Can I get a little clarification? You said look at converting things or what needs to be done to meet park standards.
Not park standards. So the National Park Service looks at a universal design,
Right.
and I had the inkling that meant that when that they look at how all their parks are accessible for all types of disabilities. So that's what I was.
So how we are in comparison
Yeah.
to that.
Looking at little small things like you had mentioned the height of water fountains. We had talked about how many parking spots and how close they are to at least 200 feet to the nearest building, things like that. To see if we are going in the right direction, we're doing the right thing.
How good does that mean?
To do like a comparison.
Yeah.
Yeah,
Kind of set those up and then rate ourselves that way.
Yeah, so the universal design, I have it right here, if you want to, there's seven approaches that they have.
We can present on that next meeting. How about we do that?
Yeah.
We should present on those 7 areas next meeting.
That's something that we can start really.
Commissioner Pat,
Yeah.
keep in mind that all those things you mentioned, their guidelines are already set for that.
Okay.
And it's the minimum. What you're thinking, where I hear you talking, is that we step above it.
Mhm.
But everything that's in ADA guideline is your minimum. And we in Clarke County fight to get the minimum. So it would be great to get above in our buildings and facilities.
Yeah, so maybe we can have a presentation on the universal design,
Okay.
next meeting for sure. And we can share that information, Todd. If you share that with me, I can share it out with GOC in advance too.
Okay.
We're also looking at like signage, like getting to this building. I mean, like if I was disabled, I would have a hard time trying to figure out where to go to access
Mm-hmm,
the third floor if I wanted to see a GOC meeting. So,
mm-hmm.
but that escalator idea is an awesome idea.
But
Yeah.
these buildings will be protected under the 1990 law, right?
Yeah.
I got that.
And a historic building too.
Elevated now.
But like this,
It is, I mean,
better signage though.
it is, yeah, I agree with you.
Something cheap, something really easy to do. And if we notice other facilities, that are similar to this type of setup, just put up a sign and, you enter through the back door, so.
And I like that point, Commissioner. I think, if you're a person with a disability, potentially too, you're looking for different types of signage that we might not have. And I think that's something that's worth us doing some discovery on, and putting ourselves in their shoes to some degree to figure out what we're missing as well. So I think that's a good opportunity too. So signage, definitely. Okay, so, anything else in terms, what would be helpful next meeting as we continue to unpack this?
And family restrooms are the same as unisex, correct? Okay.
Single use.
Single use.
Single use. That's definition already.
But like, the amenities and the fixtures are gonna be the same.
Well, family restrooms will typically have the changing table.
Okay.
That's the only difference that I've seen.
They'll just meet the ADA guidelines inside those particular rooms.
And then potentially something else we're working on, Dr. Epps is doing some best practice research, and we'll work with facilities and leisure staff as well, but potentially sharing what other local governments are doing in terms of policies that y'all might begin to consider that are related to this topic. So that way we can share, hey, here's some good examples of what a potential future kind of bathroom policy is, that another jurisdiction has used, just to begin to kind of unpack potential ideas and what that might look like.
All right.
Good?
Sounds good.
All right. Anything else? Well, yeah, thanks to staff for all your work in preparing for this. So.
Good stuff, you got that. Good stuff.
All right, and if the next motion is motion to adjourn. All in favor, say aye. We'll adjourn. Thank you.
All right, thanks y'all.